CoronaVac has been approved by the South African Health Products Regulatory Authority for emergency use. Sinovac, together with its local partner Numolux, says at least 5 million doses could be shipped to the country by the end of July. Joining us now to discuss Sinovac's use in South Africa is Weining Meng, that's the Sinovac Vice President, and Numolux Chief Operating Officer Anton. Arendse. To both of our guests, thanks very much indeed for your time this morning on the AM Report here in Johannesburg. Weining, I want to begin with you as the Chief Executive of Sinovac this morning. Just to ask, it received approval from the WHO in June, about a month ago already. Are you surprised it's taken South Africa this long to have local approval?
Well, actually not. We have a very good communication with the South Africa authorities and about some details of technicals. So I'm glad that finally our CoronaVac got final approval in this country. So next step, we will supply the vaccine to the population here.
Yeah. So 5 million doses of the vaccine, hopefully by the end of July, but possibly sooner?
Well, currently we are still communicating with the several stakeholders and for the supply plan. And what I can say is, currently Sinovac already built up to 4 billion doses per year of production capability. So that means each month we can produce more than 300 million doses. And we are ready to supply. And so currently we are already preparing 1.2 million doses. And so we can ship immediately.
Well, that's certainly great news. Anton, Arendse with the Numolux Group. Tell us about your part in the Sinovac vaccine as the local partner here in South Africa.
And good morning to you. So the relationship between the Numolux team and Sinovac is a long and an ongoing one. The rise of the pandemic really just looked to enhance and entrench that relationship. To the point where the South African team now is the formal in-country representative of Sinovac. As such, all of the work that happens in country is done via our team, and as you can see, there's a very, very tight and a very close working relationship between ourselves and that of Sinovac. Insofar as the work on the ground is concerned, we've set ourselves the target to have, by close of business this week, we would like to have at least concluded negotiations with the Department of Health. I think there is a groundswell of frustration, and I'm not going to belabor the point around the slow rollout of vaccines in the country. You've heard the Vice President of Sinovac indicate their readiness to make it available, and we've previously said it on this channel. Just for the record, we're talking about an initial commitment of 5 million. That commitment is contingent on the conversations that we have with the Department of Health, and we would like to initiate that conversation during the course of this week, and in fact move to conclusion, if not very close to it, by close of business this week. Those conversations will of course include pricing, all of the logistics, in-country distribution to various sites, all of those things, including pharmacovigilance, etc., etc.
Well, actually, Anton, I'd like for us to labor the point around our delayed rollout of our vaccines here in South Africa. According to your knowledge of how the process is being conducted, should we by now know where we are going wrong and how we can be doing these things much better and, more importantly, much quicker, given the spread of specifically the Delta variant around the country?
I would not want to cast aspersions on the manner in which the Department of Health is doing its business. Excuse me. For us, really, as the private sector, it falls to us to come alongside, come alongside of government, and to augment whatever they have initiated. We know that government is the principal implementing agent insofar as the rollout of COVID-19 vaccines is concerned. They have indicated that on a number of occasions, and it falls to us, responding to the clarion call of the President to come alongside of government as the private sector in supporting government in making these vaccines available. That said, we are aware, and this is already, but it has been broadcast very widely, the number of vaccines that have been committed by some of the other vaccine companies vis-a-vis those vaccines that are readily available. And there is a rather large disjunct between the money that has been committed to those vaccines, the commitment that has been made by those vaccine companies already, and in fact, how many of those vaccines have been made available to South Africa. Certainly between Numolux and Sinovac, our approach is going to be very, very different. We want to give an indication that if there's going to be any delay in the release of the Sinovac vaccine, it's not going to be on the part of the South African and the Sinovac team. Thank you.
Weining, can I bring you back in here, because specifically as we talk about the efficacy of vaccines against the Delta variant, insofar as Sinovac is concerned, there is, shall we call it, a knowledge gap. We're not sure of the efficacy against specifically the Delta variant. No evidence at that point. Is this correct?
Well, regarding the efficacy, actually, previously based on our phase 3 clinical studies in several countries, and also the real-world studies conducted in some South America countries, we already see the vaccine is very effective against COVID-19, and especially for the hospital cases and severe cases. And the real-world studies data already show the vaccine has a quite good efficacy against the Gamma strain, which strain is to dominate in the South America countries. And regarding the Delta strain, and based on our data from our laboratories, actually we see the vaccine even have a better potency comparing the Gamma strain. So I have mentioned that for the Gamma strain, actually the real-world studies already support the vaccine has a quite good effectiveness. So from that point, we are very confident for the Delta strain. CoronaVac also will play a very good job against that.
All right. So very confident for its efficacy against the Delta strain. Approved for the use for people between the ages of 18 and 59. That's what the South African Health Products Regulatory Authority has approved Sinovac for that particular age group. Is that the case as well in other countries where your vaccine is being rolled out?
Well, actually, in other countries, most of, firstly, I would like to give you a whole pictures for the vaccine rolled out in other countries. Currently, CoronaVac already approved in around 50 countries in the world. And the vaccine already been distributed to more than 40 countries. Most of the countries, the vaccine are suggest to use for the population age 18 and above. And some countries even start the vaccination by using the CoronaVac from the very old people population, even 100 years old, such as in Turkey, in Brazil, in Chile, and they all follow this. And so we will keep the communicates with South Africa authorities and keep supplying the data from different population. And well, currently we are also working together with our partners to initiate the clinical studies, even for the pediatric group, 3 to 17 years. So our target is quite clear, and just to supply more vaccine and to more people in this country.
What about for pregnant and lactating women?
Yeah, for the pregnant women and lactating women, actually the vaccine already start used for such a group of people in Brazil and in Chile. And there, I remember it just one article just published, I think yesterday, and to indicate after the vaccination of the CoronaVac, actually newborn baby also has IgM already available to against this COVID. So, well, the vaccine already started used, and but besides of that, currently we are also working together with the partners in different countries and trying to collect more data from such special groups.
Yeah.
Yeah.
Anton, in terms of storage for the Sinovac vaccine, what are the considerations that need to be made?
Very simple. Storage between 2 and 8 degrees, so you could put it in your fridge. So it lends itself perfectly to South African conditions.
Yeah. And in terms of it being a 2-dose vaccine, Weining, you know, what can you tell us about the efficacy of the first shot, and then how long you should be waiting to administer the second shot of the vaccine?
Yeah, you know, the CoronaVac is the inactivated whole virus vaccines. For such kind of vaccines, normally people need to get 2 shots and to gather enough antibody level to against the disease. So well, after first shot, although we can get some a certain level of antibody, but considering current, there are several variants already circulating in different countries. So I strongly suggest people should get the second dose 3 weeks to 4 weeks after first dose. And then we're waiting for, but people still need to waiting for at least 1 or 2 weeks. And then the body will generate the antibody to against this COVID. So, but even that, I still suggest people still should, you know, taking other measurements, such as wearing the mask and washing hand frequently, and just protect yourself and also other people.
Yeah. Some great advice there, and certainly sounds like a good news story for our country in the grips of a third wave of infections. Let me thank both of our guests for joining us for this discussion this morning. Anton Arendse is Numolux's Group COO. He's the South African partner for Sinovac, the vice president of that company. Joining us as well, Weining Meng. To both of you, thanks very much for your time indeed. So some great points there coming out of that interview. The Sinovac vaccine can be stored in the fridge, already showing great efficacy, according to evidence from other countries, against the Delta variant, which is now rampant in South Africa, certainly offering some protection against serious illness and hospitalization. Those knowledge gaps that do exist will be relying on the information coming from other countries insofar as the use of this vaccine is concerned. 5 million doses is what we've secured for South Africa. Delivery set for the end of July, but hopefully we're told before then, sometime earlier.